Pregnancy diagnosis. An early diagnosis of pregnancy is essential for reproductive management as well as economic production. This chapter begins with the importance of pregnancy diagnosis. It is followed by the traditional practice of establishing pregnancy, the suppression of the estrous cycle. Clinical and immunologic methods are described for the diagnosis of pregnancy. The choice of method depends on the species, stage of gestation, cost, accuracy, and speed of diagnosis. Here are the importance of pregnancy diagnosis. First, to identify non-pregnant animals soon after mating or insemination so that production time loss from infertility may be reduced by appropriate treatment or culling. Next, to certify animals for sale or insurance purposes. Third, to reduce waste in breeding programs using expensive hormonal techniques. And last, to assist in the economic management of livestock. During pregnancy, the concepts inhibits the regression of the corpus luteum and prevents the animal from returning to estrus. Therefore, an animal not returning to estrus after service is assumed to be pregnant. So here are the techniques of pregnancy diagnosis, the clinical methods, and the immunologic test. In clinical methods, it depends on the detection of conceptus fetus, fetal membranes, and fetal fluids. Clinical methods include rectal examination and ultrasonic techniques. We have here the rectal examination under the clinical method. Rectal examination is the accepted method of pregnancy diagnosis in mare, buffalo, and cow. The procedure is the uterus is palpated through the rectal wall to detect uterine enlargement occurring during pregnancy. In this technique, it can be performed at an early stage of gestation, and it is accurate and known immediately. The result is known immediately. Rectal examination is unsuitable for ewe, goats, and sows because they have a small pelvic cavity, and it is not suitable for rectal exploration of uterine contents. However, the middle uterine arteries in parous sows are readily accessible for palpation through the rectal wall. In sows, detection of a primitus in one or both uterine arteries is rapid, from 28 days onward. Ultrasonography is also one of the clinical methods. Ultrasound waves are inaudible to the human ear and operate at frequencies of 1 to 10 MHz. There are two types of ultrasound that are employed in human and also to veterinary medicine. It is the Doppler phenomenon and the pulse echo principle. In Doppler phenomenon, sound waves striking a moving object are reflected to the transmitting source at a slightly altered frequency. The ultrasonic fetal pulse detector that is based on the Doppler phenomenon consists of a transducer and a amplifier. In this image, the transducer, when applied to the animal's abdominal wall or inserted into the rectum, emits a narrow beam of high-frequency waves, and the movements of the fetal heart or blood flow in the fetal or maternal circulation alter the frequency of these waves. It is reflected back to the probe, and they are converted into audible sound and amplified through earphones or speakers, or it can be illuminated through oscilloscope. The next one is the pulse echo ultrasound. pulses of ultrasound generated by piezoelectric crystals in a transducer or contacting tissues of varying acoustic impedance. Resistance to the transmission are reflected or echoed to the transducer, then converted into electric energy and displayed on a cathode ray oscilloscope in various ways. The currently basic forms in use are the A mode and the B mode. A mode, or the amplitude, is a one-dimensional display of echo amplitude versus distance, whereas B mode, or the brightness, produces an accurate two-dimensional image of soft tissue cross-section. The brightness of the dots on the oscilloscope is projected in various shades of gray, comparable to a black and white succession. This reveals any motion in the tissue being imaged, and this is the basis of B mode real-time scanning. In this image, there are major components of an ultrasound machine. It is an electric pulse generator, a transducer, a scan converter, and a video display. A high voltage electric pulse of a few microseconds causes the piezoelectric transducer to vibrate and convert electrical to mechanical energy, which is the ultrasound. And the result of these waves, or the echoes from the tissue surfaces on reaching the transducer, produces an electric signal that is processed by a scan converter and displayed on a video monitor. So, gamit yung mga anode and cathode, we are familiar in the word ultrasound. Kasi parang pareho din naman yung ultrasound ng tao sa animals, na nakikita mo rin yung image, nalalaman yung months. So, ayun, through ultrasound, nalalaman natin kung ilang months na yung fetus, at nalalaman natin kung how many weeks or months na ito. So, through these clinical methods, we can determine, or we can diagnose the pregnancy.
Good afternoon, sir. Our topic is all about immunologic methods of pregnancy diagnosis. So, the immunologic techniques for diagnosis of pregnancy rely on to detecting or measuring the level of substance originating in the concept. So, as you can see in the next slide, makikita natin dito na kung saan may ituturok sa animal na lalaki at ituturok na rin para sa babae na animal. Ito kasi ang maganda. Hindi na kailangan ng pagtatalik ng lalaki at babae na animal. Kumbaga, through injection na lamang. At para na rin ito para sa magandang lahi na ilalabas ng babae na animal pag nanganak siya. Okay, next slide naman tayo. May dalawa tayong types ng pregnancy. Una, yung pregnancy specific. Ito yung tiyak na pagbubuntis at lilitaw sa maternal na dugo. Ito yung tinatawag na equine-chorionic quadrotropin or maagang pagbubuntis. Okay, sa pangalawa naman tayo, sa pregnancy non-specific. Ito yung hindi tiyak ang pagbubuntis, ngunit ang mga antas ng ihi or dugo sa ina, pagbabago ng gatas sa panahon ng pagbubuntis, ay tinatawag na progesterone, estrogen, or sulfate. Good afternoon, sir.
Ovulation. So, alam naman natin ang ovulation ay kapag ang mature egg ay na-release sa ovary, tapos bababa sa fallopian tube kung saan dun na ma-fertilize. At kapag yung sperm ay nandun sa fallopian tube, kapag na-release na yung egg, syempre may chance yun na ma-fertilize, creating an embryo. In relation to that, may mga kaso kasi na yung mga animal na hindi nag-ovulate kahit pa yung animal ay ready na for mating. Due to endocrine deficiency imbalance, failure of development of hormone receptors, ganon. So, kapag yung amount or dami ng hormone na na-release is insufficient or yung timing ng release ay incorrect, the ovulation is delayed or fails to occur. Kaya may mga animals na hindi nabubuntis kahit nag-undergo pa ng mating. Mammals can either be spontaneous or induced ovulators. Spontaneous ovulation does not require physical or chemical cues from a male to bring about hormonal activity associated with the reproduction, and females display a continuous cycling of reproductive hormones. Ovulation induction is a straightforward fertility treatment that involves taking oral or injectable medication due to stimulate regular ovulation. Yung paggamit ng hormonal therapy para mas maging masigla yung ovaries for egg development and release or yung ovulation. Or yung hindi nahihintayin yung cyclical ovulation or yung kusang pag-ovulate ng female animal. So, ang goal ng ovulation induction ay makapag-produce ng single healthy egg. Methods of inducing ovulation are needed for treatment of anestrus and synchronization of estrus cycle for timed artificial insemination (AI).
Synthetic progestogen are used most commonly in hormonal birth control and menopausal hormone therapy. They can also be used in treatment of gynecological condition to support fertility and pregnancy, to lower sex hormone levels for various purposes, and for other indications. Human chorionic gonadotropin or HCG is a hormone that supports the normal development of an egg in a female ovary and stimulates the release of the egg during ovulation. HCG is used to cause ovulation and to treat infertility in female and to increase sperm count in male. In female, FSH helps control the menstrual cycle and stimulates the growth of eggs in the ovaries. FSH levels in female change throughout the menstrual cycle, with the highest level happening just before an egg is released by the ovary. This is known as the ovulation. In men, FSH helps control the production of sperm. Buserelin is approved for the treatment of hormone-responsive cancers including prostate cancer and premenopausal breast cancer, sex hormone-dependent uterine diseases including endometrial hyperplasia, endometriosis, and uterine fibroids, and in assisted reproduction for female infertility. The prostaglandins are a group of lipids made at sites of tissue, damage, or infections that are involved in dealing with injury and illness. They control processes such as inflammation, blood flow, the formation of blood clot, and other inductions of labor. Progesterone injection is a type of female hormone given to replace the hormone progestin when the body is not making enough of it. In female who are not pregnant and have not gone through menopause, progesterone is used to restore normal menstrual periods that have stopped for several months, or amenorrhea. PMSG is capable of supplementing and being substituted for both luteinizing hormone and follicle-stimulating gonadotropin of the anterior pituitary gland in both the male and female, stimulating development of the ovarian follicle. This product is licensed for use in cattle, sheep, and pigs. Estrogen conjugate are a medicine that contains a mixture of estrogen hormones. It is used to treat moderate to severe hot flashes, changes in and around the vagina, and other symptoms of menopause or low amounts of estrogen or hypoestrogenism.
Estrus synchronization in beef cattle involves manipulating the female estrus cycle so they can be bred at about the same time. The normal 21-day estrus cycle in beef cattle can be altered by following an effective estrus synchronization protocol. There are several advantages to consider when following an estrus synchronization protocol, including shortening the calving interval, which allows females to conceive earlier in the breeding season, more effectively using AI and embryo transfer to reduce time and labor in detecting estrus or the heat, and producing a more uniform calf crop similar ages.
A long luteal phase may be due to a hormone imbalance like polycystic ovary syndrome or PCOS, or a long lapse since you ovulated could mean that you're pregnant and you just haven't realized it yet. The length of your luteal phase shouldn't change as you age, but your progesterone level during this phase may drop as you get closer to menopause. A short luteal phase can be also due to the failure of the corpus luteum. If the corpus luteum doesn't secrete enough progesterone, your uterine lining may shed before a fertilized egg implants. This can cause an early menstrual cycle.